The first group we will be looking at are psychotropic drugs. They are usually used in conjunction with other treatments such as psychotherapy. These drugs are generally prescribed for sleep disorders or various other psychogenic disorders. This group includes hypnotics and sedatives, anxiolytics, antidepressants and mood disorder drugs, antipsychotic drugs, and central nervous system stimulants. It is very important people are monitored for adverse reactions, drug levels, evidence of noncompliance, dependence, and withdrawal. Sedatives, hypnotics, and anxiolytics have drug classifications and uses that overlap. Anxiolytics, or anti-anxiety drugs, are among the most commonly prescribed drugs in the United States. They are generally used to treat anxiety disorders. The three main classes are benzodiazepines, barbiturates, and buspirone. Sedatives are used to reduce activity or excitement, thereby calming the person. Drowsiness commonly occurs with the use of a sedative. When they are given in large doses, sedatives are considered hypnotics. Hypnotics induce a state that resembles natural sleep. Drugs from several classes are used as sedatives and hypnotics. They include benzodiazepines, barbiturates, and non-benzodiazepine-NonBarbiturates. Benzodiazepines have many therapeutic effects. They include medications such as Ativan, Xanax, Valium, Diastat, Klonopin, Serax, Dalmane, Librium, Halcyon, and Restoril. They may produce sedation, induce sleep, relieve anxiety and tension, relax skeletal muscles, and treat seizures. There are several medications and herbs that may interact with benzodiazepines. That is why it is so important to read the insert from the pharmacy or your drug reference before administering or supervising medications in this classification. Erythromycin, an antibiotic, and Nizoral, an antifungal, may cause increased and prolonged levels of Xanax and Halcyon. This may cause central nervous system depression and decreased coordination. When benzodiazepines are taken with other central nervous system depressants, such as alcohol, anticonvulsants, and sedatives, increased central nervous system depression can occur. The signs of CNS depression include decreased levels of consciousness, reduced muscle coordination, respiratory depression, and death. When Dalmane is taken with birth control pills, it can decrease the rate Dalmane is metabolized and increase the risk of toxicity. St. John's wort can decrease the effectiveness of several benzodiazepines, and kava can increase the adverse CNS effects of several benzodiazepines, including Valium and Klonopin. Adverse reactions to look for are amnesia, lack of coordination, dizziness, muscle weakness, respiratory depression, rebound insomnia. Abrupt withdrawal may cause weakness, delirium, and clonic-tonic seizures. Barbiturates reduce overall central nervous system alertness. In low doses, they cause drowsiness. In high doses, they may cause respiratory depression and death because they can depress all levels of central nervous system function. The most common barbiturate you will be seeing is phenobarbital, and its most common use will be for seizure control. When taken with Dilantin, it may reduce the rate phenobarbital is metabolized and increase the risk of toxicity. Adverse reactions to watch for are allergic reactions such as fever, rash, or welts, slow heart rate, slow respiratory rate, idiosyncratic reactions such as agitation, anxiety, excitement, rage, and restlessness. Signs and symptoms of toxicity include central nervous system and respiratory depression. These can lead to respiratory failure and cardiac arrest and death. Drugs in the non-benzodiazepine, non-barbiturate class are generally used as hypnotics only for short-term use of simple insomnia because they lose their effectiveness by the end of the second week. They include drugs such as Ambien and Sonata. When used with other central nervous system depressants, they can cause an additive effect resulting in drowsiness, respiratory depression, stupor, coma, and death. Taking Ambien and Sonata with meals can delay the onset of sleep. Adverse reactions to watch for include dangerous symptoms similar to those of barbiturate withdrawal, with abrupt withdrawal of large doses, dependence or tolerance, gastric irritation, nausea and vomiting, and hangover effect. Remember, all of the medications described in this classification may cause respiratory depression, respiratory failure, and death. It is important to monitor the person closely for any of these signs and symptoms and always give as directed. Anti-anxiety drugs are among the most commonly prescribed medications. Buscarone's structure and mechanism of action is different from other anxiolytics. It has several advantages over those drugs, including less sedation and no central nervous system depression when taken with alcohol, a sedative, or hypnotic. There is also less potential for abuse. If the person you are caring for is taking an MAO inhibitor, it is very important to monitor for high blood pressure reactions. Always be sure that doctors are aware that the person is taking buscarone. There are medications such as erythromycin that can increase buscarone's levels. This will require a reduction in the dosage of the buscarone while both medications are being taken. Another concern is that it also may increase the levels of haloperidol. The most common reaction to buscarone includes dizziness, lightheadedness, insomnia, fast heart rate, palpitations which feel like the heart is flipping over in your chest, and headache. If the doctor is switching from long-term benzodiazepine to buscarone therapy, the benzodiazepine should be tapered off to avoid withdrawal symptoms. Antidepressants and mood disorder drugs are used to treat affective disorders, which are disturbances in mood characterized by depression or elation. Drugs included in this category are Selective Serotonin Re-uptake Inhibitors or SSRIs, Tricyclic Anti-Depressants, MAO Inhibitors, and other antidepressants, and the mood disorder drug Lithium. SSRIs were developed to treat depression with fewer adverse reactions than tricyclic antidepressants and MAO inhibitors. They inhibit the neuronal uptake of serotonin, thereby increasing the amount of circulating serotonin. They are as effective as tricyclic antidepressants for major depressive episodes. They are also used to treat obsessive-compulsive disorder, social anxiety disorder, premenstrual dysphoric disorder. SSRIs may be useful in treating panic, eating, personality, impulse control, anxiety, and post-traumatic disorders. Sudden discontinuation of an SSRI may cause SSRI discontinuation syndrome. This syndrome may cause physical effects such as dizziness, vertigo, loss of muscular coordination, nausea, vomiting, muscle pains, tremor, and migraine. Psychological effects of SSRI discontinuation syndrome may include anxiety, irritability, sadness, and vivid dreams. In order to prevent SSRI discontinuation syndrome, the doctor will gradually taper off the client's SSRI doses over a period of several weeks. If the person is taking SSRIs, remember, symptom relief may not occur for 2 to 4 weeks. No over-the-counter or herbal supplements without consulting the prescriber. Serious interactions may occur. May take with food, report central nervous system or respiratory depression, Avoid activities that require concentration or coordination until the full effects are known. Be sure all prescribing healthcare providers are aware that they are taking an SSRI. Give SSRIs before bedtime or with food to minimize the anticholinergic effects, such as confusion, blurred vision, constipation, dry mouth, lightheadedness, difficulty starting and continuing to urinate, and loss of bladder control. If the dose of fluoxetine exceeds 20 milligrams daily, the dosage should be divided into 2 doses, a morning and afternoon. Clarify instructions with the doctor if this is not the case. If the person develops a rash when taking fluoxetine, hold the dose and notify the prescriber. Again, I cannot emphasize enough how important it is to read your drug information before giving medications. There are several potentially life-threatening interactions that may occur if SSRIs are taken improperly or with the wrong drug or wrong herbal remedy. Medications such as Tegretol, Tambacor, Metoprolol, Tricyclic Anti-Depressants, Clonazepam, and Thorazine may increase the level of the interacting drug and increase the risk of toxicity. Taking SSRIs with St. John's wort may increase the serotonin reuptake inhibition, which may lead to increased sedative hypnotic effects. The use of SSRIs with an MAO inhibitor can cause serious, potentially fatal reactions. Adverse reactions to watch for and report to the doctor for common SSRIs include Celexa, dry mouth, nausea, insomnia, being overly sleepy or drowsy, and sweating. Lexapro, nausea. Prozac, anorexia, which is the loss of appetite and ability to eat. Diarrhea, nausea, anxiety, headache, insomnia, nervousness, rash, and sweating. Fluvoxamine, diarrhea, nausea, dizziness, dry mouth, headache, insomnia, being overly sleepy or drowsy. Zoloft, diarrhea, nausea, dry mouth, dizziness, insomnia, being overly sleepy or drowsy, fatigue, tremor, sexual dysfunction in men. Paxil, weakness, constipation, diarrhea, nausea, dizziness, headache, insomnia, being overly sleepy or drowsy, ejaculatory and other genital disorders in men. Sweating. Tricyclic antidepressants are generally used to treat episodes of major depression. They're especially effective in treating depression whose onset is subtle, when the depression is accompanied by weight loss, anorexia, or insomnia. The physical signs and symptoms may respond after 1 to 2 weeks of therapy. The psychological symptoms generally will require 2 to 4 weeks to respond. Tricyclic antidepressants are much less effective in persons with hypochondria, atypical depression, or depression accompanied by delusions. There may also be used in preventing migraine headaches, treating phobias, urinary incontinence, ADHD, diabetic neuropathy, and certain types of chronic pain. Remember, if the person is taking tricyclic depressants, it may take several weeks to become therapeutic. Take exactly as prescribed. Overdoses are commonly fatal. Avoid alcohol. Avoid hazardous tasks until the full effects are known. Avoid excessive exposure to sunlight. Diabetics need to monitor their glucose levels carefully. Sugarless gum, hard candy, or ice chips may help with dry mouth. Report any repetitive movements to the doctor. There are several drug and herbal therapy interactions you should be aware of. For interactions specific to the medication you are giving, please be sure to refer to your drug information resource. When taken with epinephrine, amphetamines, or the herb ephedra, high blood pressure may occur. When taken at the same time as a barbiturate, can decrease the levels of the tricyclic antidepressant, and Tagamet can impair liver function, thereby increasing the risk of toxicity. The use of a tricyclic antidepressant with an MAO inhibitor may cause an extreme increase in body temperature, excitation, and seizures. Adverse reactions to watch for include anticholinergic reactions such as blurred vision, constipation, dry mouth, urine retention, decreased libido, inhibited ejaculation, and a fine resting tremor. Jaundice, the yellowing of the skin or the whites of the eye. Mania, orthostatic hypotension, which is low blood pressure, like when you get out of bed too quickly or stand up quickly and your head swims. Sensitivity to light, psychosis in susceptible patients, rash, sedation, seizures with high dosage, and heart rhythm problems. MAO inhibitors appear to inhibit monoamine oxidase, also known as MAO. MAO is an enzyme that may affect neurotransmitters that work with nerves to transmit information or impulses. They are used to treat typical depression that has not responded to other therapies or when other therapies are contraindicated. They may be used for panic disorder with agoraphobia, eating disorders, post-traumatic stress disorder, pain disorder, and atypical depression. MAO inhibitors interact with many medications, both prescription and over-the-counter, herbs, and even food. It is very important to withhold an MAO inhibitor for 2 weeks before starting the person on a different antidepressant. This is done to prevent elevated body temperature, excitation, and seizures. The most serious adverse reaction to MAO inhibitors is a hypertensive crisis, which can lead to death. Increased blood pressure, severe headache, palpitations, the heart feels like it's flipping in the chest, nausea, vomiting, neck stiffness or soreness, fever, clammy skin, excessive dilation of the pupil, photophobia, which is the abnormal sensitivity or intolerance of light, or other visual disturbances are signs and symptoms of hypertensive crisis. Slow heart rate or fast heart rate, chest pain and bleeding in the brain also may be found with hypertensive crisis. The most common adverse reactions are drowsiness, restlessness, dizziness, headache, insomnia, constipation, anorexia, nausea, vomiting, weakness, joint pain, dry mouth, blurred vision, swelling to the hands and feet, urine retention, transient impotence, rash, and purpurea, which is a disease characterized by purple or brownish red spots on the skin or mucous membranes, caused by blood being forced into surrounding tissue. Remember, avoid foods rich in tyramine and large amounts of caffeine. Tricyclopramine is the MAO inhibitor most commonly reported to cause hypertensive crisis with the ingestion of foods high in tyramine. Sit up for 1 minute before getting out of bed to avoid dizziness. Avoid overexertion because MAO inhibitors may suppress chest pain. Don't take over-the-counter or herbs without consulting the prescriber. May cause severe adverse reactions. Don't stop taking medication suddenly. As I mentioned in the previous slide, MAO inhibitors interact with many medications, herbs, and foods. For this reason, read the drug information and follow all precautions. Immediately report concerns to the doctor. If the person is diabetic, carefully monitor his or her blood glucose levels. MAO inhibitors may enhance the hypoglycemic effect of the medication. Therefore, they are at higher risk for low blood sugar. If you go to the emergency room or admitted to the hospital, it is very important the doctor and nurses know that they are taking MAO inhibitors. If given Demerol for pain, it may cause excitation, high or low blood pressure, extremely elevated body temperature, and coma. One of the most difficult things for the people and their family is most of the dietary restrictions that must be followed. It can be dangerous for them to eat foods which are rich in tyramine. Eating foods rich in tyramine can produce a hypertensive crisis and possibly death. Tyramine-rich foods include cheddar cheese and aged cheeses, herring, Chianti wine and vermouth, tap beer and ale, eggplant, figs, grapes, oranges, pineapple, plums, prunes, raisins, all soy products but mainly fermented soy products, an overripe avocado, chicken liver, and non-fresh beef liver. Antipsychotic drugs are generally used to control psychotic symptoms such as delusions, hallucinations, and thought disorders that may arise from schizophrenia, mania, and other psychoses. This group of medications are also called major tranquilizers because they can calm an agitated person, and they are called neuroleptics because they may have adverse neurobiologic effects such as apathy or limited emotions. They fall into two major classes, conventional and novel antipsychotics. Antipsychotics are the first-line treatment for psychoses. They have several other uses that include, but are not limited to, treating organic psychiatric disorders such as dementia, delirium, and stimulant-induced psychoses, sedation for agitated patients, Tourette syndrome, and Huntington's chorea. Remember, take them as prescribed. Take the full dose at bedtime if daytime sedation occurs. May take several weeks for the therapeutic effect. Watch and report unusual effects, especially involuntary movements. Avoid alcohol. Don't use over-the-counter medications or herbs without prescriber's approval. Avoid activities which require concentration or coordination until the full effects of the medication are known. Avoid excessive exposure to sunlight, heat lamps, or tanning beds. Avoid exposure to extreme heat or cold. Phenothiazines may cause pink or brown discoloration of the urine. Conventional antipsychotics were formerly known as typical antipsychotics. Phenothiazines are used primarily to treat schizophrenia, reduce anxiety or agitation, improve a person's thought process, and alleviate delusions and hallucinations. Watch for adverse reactions after abruptly stopping the medication. Withdrawal reactions after long-term therapy that you need to watch for are repetitive movements, gastritis, nausea and vomiting, headache, fast heart rate, insomnia, and dizziness. Neuroleptic malignant syndrome, which is a muscle rigidity, extreme extrapyramidal symptoms, severely elevated body temperature, high blood pressure, rapid heart rate, respiratory failure, cardiovascular collapse. Although this is rare, it can be fatal. Neurologic reactions include tardive dyskinesia, which is a chronic disorder of the nervous system characterized by involuntary jerky movements of the face, tongue, jaw, trunk, and limbs, usually developing as a late side effect of prolonged treatment with antipsychotic drugs. Initially, this group of drugs was called atypical antipsychotics. Novel antipsychotics are more popular than conventional antipsychotics because they are less likely to cause extrapyramidal symptoms and other adverse reactions. They are generally used to treat schizophrenia. Adverse reactions to watch for include, for clonazepine, agranulocytosis, which is characterized by an extreme decrease in the white blood cells, fever, and ulcerations of the mucous membranes, and seizures. Zyprepirdone, irregular heart rhythms. Risperidone, extrapyramidal effects which include slurred speech, slow movement, muscle rigidity, slowing of the thought processes, dystonia, which is characterized by involuntary muscle contractions, which force certain parts of the body into abnormal, somewhat painful movements or postures. Neuroleptic malignant syndrome, orthostatic hypotension, apiprazole and quintanilide sedation, olanzapine weight gain. If the person you are caring for has any of these symptoms, call the doctor immediately. There are miscellaneous drugs that are used to treat depression. Trazodone may also be useful in treating aggressive behavior and panic disorder. Remember, this group of medication can cause central nervous system depression and may have an additive effect when taken with other central nervous system depressants. Avoid activities that require concentration or coordination until the full effects are known. Take dosage at bedtime if sedation becomes a problem. Take with a meal or snack to enhance absorption and decrease dizziness. Notify the prescriber if the person becomes pregnant or plans to become pregnant. When combined with an MAO inhibitor or any of these antidepressants, may cause serious and potentially fatal reactions. When Wellbutrin or Zyban are taken with levodopa, a phenothiazine, or a tricyclic antidepressant, it increases the risk of the adverse reactions, including seizure activity. Nifazodone or trazodone may increase digoxin levels and increase the risk of digoxin toxicity. Trazodone can increase dilantin levels, and when taken with blood pressure medicine, may cause increase in the blood pressure lowering effects. Lithium is used to prevent or treat mania and bipolar disorder, which is a mood disorder where depression alternates with mania. Adverse reactions to lithium may occur in any phase of the therapy and are usually dose-related. GI effects are the most common when therapy begins and when the dose is increased. Approximately one-half of the people taking lithium will experience a fine tremor that may diminish with dose reduction and worsen with dose increase. Excessive thirst and urination, weight gain, hair loss, and skin eruptions may also be symptoms that occur. Remember to take with plenty of water and after meals. There is a narrow therapeutic margin of safety. Be sure blood tests to monitor levels are collected. Watch for signs of toxicity. Don't stop the drug abruptly. Expect transient nausea, frequent urination, thirst, and discomfort for the first 2 days of therapy. Avoid activities that require concentration or coordination until the drug's full effects are known. Don't switch brands or take prescription medications over-the-counter herbs without the prescription's approval. People with diabetes should monitor blood sugar carefully. Wear or carry a medical identification. Give with food to decrease GI distress. When lithium levels exceed 1.5 milliequivalents per liter, toxicity may occur. For this reason, lithium levels should be routinely monitored through blood testing. Signs and symptoms of lithium toxicity include confusion, lethargy, slurred speech, hyperreflexia, which is a condition where the deep tendon reflexes are exaggerated, and seizures. Long-term use can cause kidney damage. CNS stimulants are often used to treat narcolepsy, obesity, and ADHD. They include amphetamine, atomoxetine, dextroamphetamine, methylphenidate, and pameline. Except for atomoxetine, all of the listed drugs are controlled substances. When CNS stimulants are taken with an MAO inhibitor, hypertensive crisis may occur. Another concern is that CNS stimulants may also increase SSRI's effects. There are a few things that are important to remember. Do not chew or crush sustained-released or long-acting tablets. They may cause dizziness, nervousness, restlessness, insomnia, and GI distress. Let the prescriber know if the adverse effects become bothersome. Use caution when doing activities that require focus or coordination until full effects are known. Avoid caffeine. Avoid insomnia by not taking drugs late in the evening. Many of the central nervous system adverse reactions result from overstimulation, such as restlessness, dizziness, insomnia, and headache. However, adverse reactions are not only limited to the central nervous system. Cardiovascular reactions include palpitations, fast heart rate, and increased blood pressure. An enlarged heart may occur with long-term amphetamine use. Most of the medications in this classification are controlled substances, and there is a risk of abuse and dependence associated with their use. The person should be monitored for signs of drug dependence or abuse. Also, the person's blood pressure and pulse should be checked by a healthcare provider periodically. Adverse reactions to watch for include general adverse reactions of increased blood pressure, palpitations, fast heart rate, and overstimulation. For amphetamines, anorexia, weight loss, cardiomyopathy, which means large heart, constipation, diarrhea, dry mouth, unpleasant taste. Methylphenidate, abdominal pain, anorexia, weight loss, and nausea. Phenylalanine, many of the same reactions as amphetamines and methylphenidate. Liver failure, hepatitis, and the risk of abuse and dependence. Dementia is a pattern of mental decline that may be caused by different diseases or conditions. Alzheimer's disease causes over 60% of the cases of dementia, with vascular disease, such as a stroke, being the second most common cause. Common medications used to treat dementia include acetylcholinesterase inhibitors such as Aricept, Razidine, and Exelon. They may be prescribed for mild to moderate Alzheimer's. Memantine, or Namenda, is approved for the treatment of moderately severe Alzheimer's dementia. Remember, there are also other conditions that you may see where the previously mentioned medications are prescribed.